Here's what every woman needs to know about miscarriage, from the different types to risk factors, symptoms and diagnosis of pregnancy loss. Pregnancy loss is a heartbreaking turn of events, but it's very, very common. Here are your questions about miscarriage answered. What is a miscarriage? A miscarriage, known in medical jargon as a spontaneous abortion, is the unexpected end of a pregnancy before 20 weeks gestation. During a miscarriage, an embryo or fetus is spontaneously expelled from the uterus but can't yet live in the outside world. After 20 weeks, the loss of a fetus is called a stillbirth instead of a miscarriage. Just because it often takes place early in a pregnancy doesn't mean that miscarriage isn't painful for expectant parents. What's important to remember, miscarriage is not your fault. And while many parents may not talk openly about having one, know that it happens much more often than you may realize. Read on to learn more about the causes and types along with risk factors. What happens when you have a miscarriage? When you have a miscarriage, your embryo or fetus is spontaneously expelled from your uterus before you're 20 weeks pregnant. You'll have symptoms including heavy bleeding and abdominal cramps, sometimes for a few days or longer. What are the signs and symptoms of a miscarriage? 1. You're bleeding pretty heavily. While, yes, bleeding is a sign of a miscarriage, it depends on what kind of bleeding you're experiencing. Spotting, for example, might be completely normal. As the fertilized egg burrows or implants into the uterus, you may see some spotting, says Keisha Gaither, MD, an OB/GYN and maternal fetal medicine specialist. You can also experience bleeding behind the developing placenta, she says. Bright red blood and heavy bleeding, however, should sound alarm bells, says Gaither. If the pregnancy continues after some bleeding, it can be called a threatened miscarriage, and needs to be monitored by an OB/GYN, per the U.S. National Library of Medicine. 2. You're seeing very large blood clots and tissue. While some bleeding and spotting might be normal, i.e., no cause for concern, during pregnancy, clotting of any kind should trigger you to call your OB/GYN. Some clots can even grow to be as big as a lemon, per Planned Parenthood. Your body may also pass other tissue, which will look a lot like heavy bleeding or a light pink vaginal fluid. Either way, if you're pregnant and you notice something off with what's coming out of your vagina, it's time to see a doc. 3. You have pain and cramping, like PMS. When it comes to cramping, menstrual-like cramps can be totally normal as your uterus begins to expand, says Gaither. Other times, cramping can be a sign of an early miscarriage. The cramping is from the uterus contracting trying to expel the pregnancy, says Gaither. Bleeding and cramping might also be signs of other pregnancy problems, like ectopic pregnancies, when a fertilized egg attaches itself somewhere outside of the uterus, usually to a fallopian tube. So if you're experiencing bleeding and cramping after learning you're pregnant, it's good to get checked out, regardless. 4. Your back is killing you. Just like cramping, you may also feel a lower backache that can range from mild to severe discomfort. Though, again, this can be normal in a healthy pregnancy, too. The best advice is boring, but true: always talk to your doctor if you're concerned about your symptoms, they're there to help you in every way they can. 5. Your OB/GYN doesn't find a heartbeat. To be fair, this isn't a symptom, but that's because sometimes there aren't any symptoms with a miscarriage. It may also be as simple as not feeling pregnant anymore, according to Planned Parenthood. In other situations, women can have a non-viable pregnancy, says Gaither. You may hear women also call it a missed miscarriage. It happens when a pregnancy fails to progress, especially in the first trimester. You may notice that symptoms you felt before, nausea, for instance, have disappeared, though these may not go away until hormone levels have decreased, says Gaither. 6. You're late. And you're never late. If your period usually comes like clockwork, but arrives a little late this time, and you've been having unprotected sex, you may have experienced a chemical pregnancy, says Gaither. This usually happens without you even knowing about it, unless you're trying and you take a pregnancy test. Basically, a chemical pregnancy occurs when the egg and sperm meet, implant, and your body produces the hormone HCG, but things fail to develop further, says Gaither. If you like this video, don't be shy to comment below. If you enjoyed this video, give it a thumbs up, and share it with your friends, so we can keep making them. For more videos like this, hit the subscribe button, and remember to click on the notification bell. Also, be sure to check out our other videos as well. Thanks for watching.